Hello and welcome to another live broadcast with MedStar Health. My name is Michelle Carter, and today we're joined by neurosurgeon Dr. Mark Iguchi. Today we're talking all about spine pain. Did you know that spine pain affects 80% of people at some point in their lives? How do you know if your spine pain is serious enough to consider surgery or if non-surgical treatment options should be used instead? If you want to know more, and better understand what causes spine pain and more importantly, what relieves it, then stick around, give us a like, share this broadcast with your friends. And if you have any questions in the during this broadcast, share them in the comment section as well. We're going to take some time to answer those as well. All right. So before we get started with some of my questions, I'd like to welcome and introduce our speaker, Dr. Mark Iguchi. Thank you so much for taking the time to be with us today. Could you tell our viewers a little bit about yourself and your expertise?
Sure. First of all, thank you. Thank you for inviting me on. It's a pleasure to be here with you and with everyone out there watching. My name is Mark Iguchi. I originally grew up in California and went to college in California. And then I went to med school in the Midwest in Wisconsin and then made myself uh, uh, an East Coaster about 20 years ago, landing at the University of Maryland to do my neurosurgical training. And then I stuck around, got a job at another hospital here in the Baltimore area, and just recently last year came over here to MedStar.
Well, thank you for joining us, and thanks for joining the MedStar Health family. We really appreciate it. Yeah, thanks.
Yes.
Um, so could you tell us about the spine program at MedStar Health?
Yes. Well, I am one of the 6 neurosurgeons that we have here in the Baltimore area. We all do spine evaluation and spine surgery. There is many of us here that work with spine patients. So as
Mhm.
neurosurgeons, we perform spine surgery. We also have our orthopedic spine surgeon colleagues over mostly at Union Memorial. We have our physical therapists that work with our 26 physical therapy locations in Baltimore. We have pain management physicians that also help with spine pain. And there are 2 of them here located in the Baltimore area. So we're one of many of a team that can help with your spine issues.
I like that. I like the team approach.
Yeah.
That's very great. Um, could you share what causes spine pain? I'm sure there could be multiple factors that could cause that.
Yeah, there are a lot of different things, and most of us will experience some kind of pain in the spine at some point in our lives. And me, myself, yesterday, I sat funny down in the chair in the cafeteria here, and my back hurt, and I had
Oh,
trouble
no.
walking down the hallway. So it happens to all of us.
Yeah.
But for the most part, we all get some degree of muscle strain. We've all felt it. We've all felt neck soreness, neck
Hmm.
stiffness after sleeping funny. We've all had some back pain after maybe exercising or lifting something too heavy. And that's probably the number one cause of
Okay.
neck, spine, back pain. We've just done a little bit too much with our muscles. And in that case, yeah, most of the time it gets better. There are other reasons that you can have spine pain. And those are the things that we kind of take a look at and evaluate further. And
Okay.
so most people have heard of things like arthritis in the spine. Unfortunately, we all get older, and so we all develop some arthritis in the spine. And if that flares up on you, yeah, that can cause some neck or some back pain. Um, we've probably all heard of things like bulging discs or herniated discs or slip discs.
Hmm.
Those, when they start to irritate the nerves, yeah, that can cause muscle spasms, that can cause pain as well. There are other issues, less frequent, but things like fractures, things like tumors, things like spinal instability that can also cause pain. And those are all things that we kind of take into account when we're evaluating.
Okay. Thank you for sharing that. And I think you touched on this a little bit, but where, besides the spine, where else can the pain be felt?
Yeah, so most people, when they think of, oh, my neck hurts, my back hurts, that you ask them to point to where it hurts, and they'll point
Right.
to, okay, oh, my neck. Yeah, it's right here. But when you have something like a pinched nerve, oh, sorry, my screen just went off there for a second. Sorry, guys. Um, when you have things like a pinched nerve in your neck, for example, the nerve can cause it to feel like you are having pain, perhaps in your shoulder,
Mhm.
perhaps in your upper arm, and it can also sometimes go down into your hand. So some people may come to us and say, well, my neck feels okay, but I have this burning down my arm into my fingers. Or I have burning down the back of my leg, down to my foot.
Mm.
So it's a very common thing to hear, oh, I have pain in my arm or I have pain in my leg. Um, but the pain, the reason for the pain is actually in your neck or your back. And so besides the common neck and back pains, yes, you can have pain in other locations as well.
Okay. That's good to know. And what should someone do when they first feel the spine pain? Is there like a waiting period before they should get checked out, or a waiting period for when the pain, resolves itself?
Yeah, that's an excellent question because that's probably one of the things that worries people the most. Oh, I
Mhm.
felt a twinge in my back.
Right.
Should I get that checked out right away? Should I go to the emergency room? Well, in
Mhm.
most cases, no, because, well, yeah, everyone gets a little bit of back pain. And so having some back pain, having some neck pain, and when it's okay, it's really sore. I did just work out yesterday or I lifted something heavy. A lot
Mhm.
of times that will get better within a few days or a few weeks. So
Okay.
if you were to call your doctor and say, oh, yeah, I pulled something in my back and I have some pain, a lot of the times they'll say, okay, well, just take a little bit of ibuprofen, give it a rest for a few days, and then see what happens. And in a lot of cases, it will get better. So usually we will tell people, yeah, if you're not feeling better and it's been more than a few weeks, or if things are getting worse, that's when you should really say, okay, let me give my doctor a call. Let me see what's going on and have them check me out.
Good to know. And when should patients see a physical therapist compared to when they should see a spine specialist? Are there specific symptoms that should direct one person to one expert versus the other?
Yeah, I think that oftentimes when you're first evaluating neck or spine or back pain, seeing a physical therapist, I think, is worthwhile, and they can help kind of see a lot of the muscle strain, a lot of the arthritis type pain. Um, some of the red flags, if you have significant weakness, for example, if you have pain and all of a sudden you can't lift your arm to grab something out of the glass, out of the cabinet, or if you are having such pain that you are walking and your leg is giving out on you, well, that's a little bit more than usual, and that's something that you should probably call your doctor for and get evaluated.
Okay, good to know. Speaking from personal experience, I did experience something like that towards the end of my first pregnancy.
Mm-hmm.
That back pain, I could not even sit upright. Told my OB, and she, I was like, should I go to a physical therapist? And she said, I think you should. And thankfully, MedStar Health Physical Therapy was very helpful with that. So I like that first line of defense,
Yeah,
check with your doctor, see if PT can help, and then, progress from there and see if you need to see a spine specialist. So thank you
yeah.
very much for that.
Yeah, exactly. I mean, we have great physical therapists here,
Oh,
and
yes.
the physical therapists, they are excellent. They are excellent in knowing this is something we can help with, or this is something that should be seen.
Hmm.
Um,
Hmm.
so going to physical therapy, I think, is an excellent choice.
Great. Great. Thank you very much. At this time, I'd like to pause and welcome our viewers again. If you're just joining us now, thank you very much for tuning in. I'm joined today by neurosurgeon Dr. Mark Iguchi, and we're talking all about spine pain. If you want to better understand what causes spine pain and better yet, what relieves that pain, stick around, share this broadcast with your friends, give us a like to let us know that you're watching. And if you have any questions, please share those in the comments section as well. All right, so let's talk about the diagnostic process. Could you take me through that? What should the patient expect?
Sure. And usually when people come in for a visit with us, the first thing that we want to do is listen and hear how you describe the pain. Because oftentimes, just the way that you describe the pain can give us very strong clues as to what's going on. So someone that comes in and says, my neck hurts, but that's it. No other issues. Okay, that could be a muscle strain in the neck. It could be arthritis flaring up in the neck versus, oh, my neck hurts and I have pain shooting down my arm and I
Mm,
can't lift a gallon of milk because my arm is weak. Okay, then we immediately start thinking this sounds like a pinched nerve um, issue rather than a muscle strain. And so just listening to you, the patient, it can help us kind of guide which way are we going to go. If we need to get further tests, X-rays are helpful. MRI imaging can help us see if the nerves are getting pinched. It can help us see the arthritis in the spine. And so a lot of times people with pain that isn't getting better will get those X-rays and MRI. Then usually we can order other specific tests depending on your exam and what that X-ray and MRI show.
okay. And if the X-ray or MRI shows that possibly pain, spine surgery is down the line for the patient eventually, that can be, very intimidating. So let's talk about our, conservative treatments. Could you explain some of those treatment options? What is available to patients at first?
Sure, yeah, I completely understand that spine surgery is very intimidating. It's not the first thing that we ever think of. Even when you come to a neurosurgeon, we want to see how we can get you feeling better and potentially avoid surgery. So
Okay.
our goal is to listen to you, order the correct tests, make a diagnosis, and see how we can get you feeling better. So, like we spoke before, physical therapy is wonderful at helping a lot of these conditions. So a referral to physical therapy where they can help with exercises, stretches, heat, massage. All of these things are potentially helpful to help with the spine pain. Then, if things are not getting better, sometimes referral to our pain management colleagues where they can consider things like a steroid injection or other tests. Steroids are anti-inflammatory, so if it sounds like you have nerve inflammation, a steroid injection is potentially helpful to get that pain to calm down. And there are other treatments. Each one is kind of individual for you. So based on what you tell us, then we can help and kind of recommend the best course of action.
All right. Thank you very much. What are the top signs or symptoms that surgery may be necessary after all?
So some of the things that some of the reasons why people end up having surgery. Number one is okay, I did all of this. I've been trying physical therapy. I tried pain management. My MRI shows this. I'm not feeling better and I can't live with it. So we've exhausted everything. We've tried everything. Unfortunately, things aren't getting better. So that's the appropriate time that we talk
Okay.
about, okay, how can we help with surgery? There are some other conditions that may require surgery sooner. And those are specific to everyone, but for example, if your spinal cord is in danger, if you have an MRI that shows your spinal cord is getting pinched and we're worried about it, then we are going to recommend surgery sooner because we don't want someone to wake up one day and say, oh, my pain or my weakness is really bad. And now I need to do something about it. So there are some conditions that we know are going to get worse potentially, and that's when we'll kind of recommend surgery sooner.
Okay. And who is the typical spine patient?
Well, spine patients can vary, from, and here we see patients that are even 18 all the way up to 90 plus. Uh, but typically, we all get older, and unfortunately, we all get some wear and tear on our spine. And as time goes on, yeah, there's a little bit more arthritis in the spine. Our discs may bulge a little bit more. And so typically, we see a lot of 50s, 60s, 70-year-olds here in our clinic. And that's probably about the age range that if you would ask your friends who are 50, 60, 70, hey, how's your back? Oh yeah, flared up on me. Oh yeah, we all get it. So that's probably the typical spine patient that we see.
Okay. And we know surgery is a major decision. How do you work through the pros and the cons with each patient?
Yeah. Excellent question as well. Yeah, when we discuss surgery, it's always a team approach. We want to make sure that you, the patient, understand why are we doing the surgery. Um, Oftentimes, if you're having pain, the reason for surgery is to help with the pain. And so we want to give a realistic expectation. Okay, here's our goal. This is why we're doing it. This is what your MRI shows. We've tried everything else. Hasn't seemed to help as much as we would have liked. And here's the surgical plan. If we see a pinched nerve, our goal is to unpinch a nerve. If we see a broken bone in the spine, our goal is to help stabilize that broken bone. So the surgery discussion will kind of depend on the specific condition. We know, unfortunately, no surgery is 100% safe. And that's unfortunately the risks of surgery. There's always the risk of getting anesthesia. There's a risk of an infection. There's a risk of bleeding. But those risks, and as time has gone on, medical technology is much, much safer than it was even 20, 30 years ago. And so for many people, surgery is safe and the risks are minimal, but they're not zero. And so the surgical decision making, we want to make the decision as a team. We want to discuss the risks as well as the benefits and come up with a good surgical plan that we both agree with.
I like that. I like you involve the patient, so it's personalized care. You have that team approach, getting all of the specialists involved. We need to be involved in that process and make the right decision together. So you mentioned a little bit about how techniques have changed, technology has changed over the years. How have spinal surgical techniques evolved in recent years? What capabilities are out there?
Oh, yeah, even when I started training, which was 20 years ago, we didn't have a lot of the technology that we do today. And so one of the things that MedStar has is the help of computer navigation during surgery. And so based on your preoperative MRI or a CAT scan, we can use those images, see them in the operating room, and basically know where to cut, where to drill, even before we cut and drill. And so it's something that is a game changer in terms of safety and doing things more efficiently. Here at MedStar, we have the capability of using that computer-based navigation here in the operating room. We have an intraoperative CT as well as 3D fluoroscopy that can help create images real time in 3D in the operating room while we're operating to help us with the operation. And so all that technology is available here.
That's great. That's great. And what should patients expect in terms of the recovery process after surgery? I imagine it varies by treatment and by patient. So what's that process like?
Yeah, so that's something that we will go through with all of you based on your surgical plan, and that can be something as simple as, okay, you're coming in for a minimally invasive microdiscectomy. We expect that you go home the same day. We want you to take it easy. walk around, but don't do anything strenuous for a couple of weeks, and then gradually get back into your normal activity to something larger
Okay.
that maybe for a fracture, oh, we need to do a larger surgery to stabilize your spine. Okay, you will be taking it easy for 6 to 12 weeks. You may need to go to rehab. And so each situation is a little bit different. But that is the kind of thing that we will discuss with you before your surgery. Make sure that you're comfortable and knowledgeable with your recovery plan.
Okay. And in the long term, what outcomes should patients expect, and what are their lives like after surgery?
Yeah. Uh, Good question as well that we also will hopefully discuss with you before surgery. And just like everyone's diagnosis and treatment plan, this is going to be individualized for you. And so kind of knowing what we're dealing with before helps us predict how people do afterwards. And so just as an example, if you were to take a bulging or herniated disc in the neck. Some people ask, okay, what is the success rate for surgery? And we will say, okay, the overall success rate based on everything that we know is probably between 80 to 90%. And these are just general terms of if you were to ask someone a few years down the line, are you happy that you had this spine surgery? 80 to 90% of people will say, yes, I'm happy. Of course, unfortunately, yeah, there are going to be 10% of people that will say, oh, I still have neck pain or this happened. But 80 to 90% is pretty good when you consider maybe 20, 30, 40 years ago, the same surgeon would have said, well, it's probably a 50-50 thing. So I think with all the technology, with all the advancements in imaging and in treatment and with surgery, I think the success rates are going to continue to keep climbing.
That's great. That's good news to hear.
Yeah.
That's good news to hear. So, Dr. Iguchi, you've dedicated your career to helping people live better lives through spine surgery. In your opinion, why is it so beneficial?
Well, one story I'll share. When I had just finished medical school, I woke up one morning and I had pain in my neck, and I felt pain shooting down like a lightning bolt down my arm and into my two fingers here. At that time, I was a neurosurgery intern, so I kind of had an idea of what was going on. I tried taking ibuprofen. I tried physical therapy. It wasn't getting better. In fact, it was getting worse. And then I got an MRI of my neck, which actually showed that I had a herniated disc hitting my nerve number 7. Nerve number 7 would go down the arm. So it fit perfectly. Because it wasn't getting better, I myself actually had a discectomy in my neck when I was 30. So it happens to all of us. Happened to me when I was 30. And because I was an intern in neurosurgery, I could still choose the path I was going ahead. And because I felt terrible with that nerve pain, and right after the surgery, I felt a lot better. And as the weeks go on, yeah, that pain went away. And to this day, 20 years later, I feel good. And so I remember how I felt, and I remember how comforting the surgeon was and said, we see what's going on, we can take care of it. And so that, I think, helps me feel a little bit more empathetic with our patient because I felt exactly what you're feeling. I know exactly how you felt. And so that's kind of the decision that made me kind of want to specialize in spine surgery. So
That's great. That's amazing. A great story. Thank you for sharing. Your experience. I know it's not, it's unnerving. It's concerning to wake up with pain in your body that you didn't feel the day before, and it progresses and progresses and progresses. And
yeah,
thankfully, there are solutions out there, and they're thankfully getting better as the years go by, as the technology gets better. Before we go, I wanted to talk a little bit about the anatomy of the spine. I think you have a few things that you brought with you to
Yeah,
share for our audience. So I just
sure.
wanted to give you some time to share those.
Yeah. Well, when you come and see us, you'll be in our office, which looks like there's a nice picture there that a lot of the patients like to look at here. Um, and we have these models here in our office that, and this is a model of the lower back.
Okay.
So just very quickly, because everyone likes to look at these, the bones of the spine here, there are 7 in your neck, which is way up here. There's 12 in your thoracic spine. And this is the lower back, the lumbar spine. And so this is what the bone looks like here from the front. Here's the side view, and here's the back. So these are the vertebral bodies, 1, 2, 3, 4, 5, and then here's the tailbone, the sacrum down here.
Okay.
The discs, we've all heard of bulging discs. Well, those are the shock absorbers here in between the bones of the spine. And so when you're 21 years old, these are nice and spongy and they're great shock absorbers. But as we get older, just like the shock absorbers on your car, they start to wear out. And so as these start to wear out and kind of shrink, this bone here is putting more pressure on its neighbor. And so bone on bone starts to create arthritis. Arthritis start to affect the bone that sits back here. So the disc wearing out and arthritis here is a very common cause of back pain, spine pain. Here are the nerves in your lower back, these yellow things here. And if a nerve were to get pinched, that can also cause pain. In your lower back, the pain can go down into your leg. So an issue like a herniated disc. So if this disc, I think there's a red
See a red
disc
one,
here
yes.
that represents a disc that is bulging out. And what lives right behind the disc? Oh, it's the nerve. So a disc that's bulging out and hitting the nerve, well, that can cause spine pain as well. So when you come in and see us, we'll have your x-rays, we'll have your MRI, we have these spine models, and we hope that we can explain what we see on your MRI and help you understand what's going on. So I think that's the best thing that people say when they come here and they leave and they say, I finally understand what's going on, then I feel like I did my job. So
That's great. That's great. I think that, yeah, that education piece is very important for patients because you're going to be going through, maybe spine surgery, maybe physical therapy as that first line of defense too. But you want to know what's going on in your body. You want those answers as to why am I feeling the pain that I'm feeling. So thank you for making that connection with us. Finally, could you share what do you most want to share with people today, and what do you want them to take away from our conversation about spine surgery?
sure. Um, well, I think one of the things that will unite us all is that this is very common. Neck,
Mm.
back, spine pain is very common. I just went on a cruise a few weeks ago, and once people hear that you are a spine surgeon, you can't imagine how many new friends you get because they all want to
Everybody
ask
has a
you
question.
about themselves. And so it's a very common issue that we all deal with. And so, everyone's a little bit different in what they have. And so spine surgery is one thing where you can't say, oh, I have neck pain. Okay, here's the treatment. No, it's not like that. Everybody's condition is slightly different. Everyone's treatment is slightly different. And you do have, 7 bones in your neck. You have 12 in your midsection. You have 5 in the lower back. So there are a lot of different areas, a lot of different nerves that can be affected. And so we want to individualize your diagnosis, your treatment plan. And if it needs surgery, we want to be able to figure out what's the best surgery for you because we want you to feel better. And so 80% of the people that come into the office here don't leave with the surgery. But I hope 100% leave with a better understanding of what is bothering them. So we welcome, everyone out there. We welcome you to come in, even if you have silly questions. Hopefully we can help to answer them, because this is something we all deal with at some point in your life.
Yeah. Well, thank you very much for that message. And thank you to all of you out there for tuning in and spending your time with us today. To schedule a spine evaluation with Dr. Iguchi or another one of our neurosurgeons here at MedStar Health, please call 443-777-8807. We're going to add that phone number as well in the comment section. Thanks again, Dr. Iguchi. We really appreciate your time today. And thank you all and have a great rest of your day.